It's not a guarantee, but it's not wrong in that often.
Hey Joshua,
Yes.
so you said it covers through the end of the year. Do you start back at the initial coverage the beginning of the next year?
Correct. So Medicare's, in all intents and purposes, it's an annual product. So the prescription coverage you have right now, if you were to go back and find your enrollment book and look at it, it says January 1st to December 31st, 2018. At the end of this year, all those plans go away and new versions for next year come out. So benefits change, formularies change, tiers change, doctor networks change. The duck, in my opinion, you just basically look at it as they shuffle the deck every year, and you need to reevaluate every year. Has anybody been on the same plan for 5, 10 years? Because I would say probably half the people I help, that's how the situation is. You get so comfortable in what you know that you don't look, or you don't have someone that like myself that can help you look. Because if you were to go to the website, is anybody really good on the computer in here? Iffy at best, right? And so the tools that are available to you to help you are so complex and moving part that you can't even figure it out anyway. And so, like I said, with this, I could spend the rest of today and probably half of tomorrow going over the details of how all this works to try to get you to understand. With the nuts and bolts, 97%, not 93% of people stay in this bucket. 7% end up over here. Yes?
So if an illness comes up spontaneously, is that automatically transitioning from one to the other?
Well, if an illness comes up spontaneously, that means some medications are going to come up spontaneously probably at the same time, and depending on where those medications fall, tier and cost-wise, you may end up staying here, or it may cause you to go through. Usually the folks I see end up here, it's before July that it happens. So there's, for example, the hepatitis C cure that they have now. That prescription is $10,000 a month, and you have to take one pill a month for 6 months, so it's $60,000 worth of treatments. That'll push you in and out of the gap in 2 months, 1 month. And so just depending, so there's certain categories that are notorious. Rheumatoid arthritis is one where right now every drug is in patent form still, so there's no generics. And there's a few categories where the treatments are so new that there is no generic yet. And the rule is 7 years, then the generic can come out. The patent expires and they can have generics come out. So that's really when the market becomes stabilized.
Do you know if there's going to be coverage next
Yeah, go ahead.
January?
If you have an illness that comes up spontaneously, do you as a person have to do the changes between those three categories?
No, that's all automatic done by the plan on the backside, but it is a good idea because they might say your doctor doesn't check your plan when he prescribes medication. So you can say, here, take this one to the pharmacy and get that filled, and then you go to refill it. What does the pharmacy say? Well, that's not covered. Well, you owe us $8,000 for this drug. Well, I guess I'm not taking that drug. If that happens, that's where I can help too. Because there's every rule that they have with Medicare, there's an exception to that rule. You just got to know what hoops to jump through and what order and how high and all that kind of stuff. So prior authorization limits, quantity limits. So some prescriptions, mostly narcotics, I'll get you a question in 1 second. Mostly narcotics are put on a quantity limit. And then step therapy. So if there's 3 or 4 medications available for your condition, they want you to demonstrate that you tried the lower cost ones first and they were non-effective before they'll agree to pay for the most expensive. Yes?
So my generic drugs aren't in the drug. I have one drug that is not generic.
Sure.
So that's what costs.
Yep. So you don't get into the coverage gap with generic drugs. You get into the coverage gap with tier 3, 4, or 5 medications. Yes, ma'am.
Do we know that there's going to be coverage next January?
Well, there will be coverage as far as what the specifics of what plans are available and all that. I've gotten a sneak peek, which I can't share with anyone until October 1st. But yes, there's going to be coverage next year. In fact, all of you can live safely knowing that the coverage will always be there for you. There's nothing going on. Once a name brand drug files a patent for their drug, they have 7 years to operate independently with no interference. After the 7th year, then generic companies can come in. If you miss your enrollment window for Part D, which is the same as it is for Part A, Part B, and Part C, the 3 months before, the month of, and the 3 months after your birth month, then you have a penalty if you miss the window and you don't have credible coverage. If you qualify for Medicaid or any LIS, the low-income subsidy extra help, they pay the penalty for you if there's supposed to be one. Because what will happen in some situations, January 1st, 2006 got here and Mrs. Johnson couldn't afford to pay the premium on a drug card. So she decided, I'm not buying one. And now she needs one because she has new medications and this and that. she would normally have a penalty, but if we get you qualified for low income subsidy, Medicare Savings Program, or Medicaid, they're going to eliminate that penalty for you. So that's what this program. The low income subsidy program is a great program. What it does, if you qualify, and it's income and resource based. And so those are the two variables they look at. If you're under the line on both variables, great. If you're off on either one by 1 cent, no. So the line that you're looking, all individuals in the room, so if you file your taxes as an individual, your income cannot be below $1,550 a month. If it's below that line, you're eligible on the income side for potential assistance. Resources can't be below, it's a little over $14,000 for partial LIS. Full LIS and Medicaid, you have to have resources less than, it's right around $7,000, $67 and some change. If you qualify, it does some great things. One, it'll pay the premium on your plan if your drug coverage has a premium up to a threshold. It's right around $33 a month. Question to ask if you're looking at coverage, is this LIS qualified coverage for the drugs? If it is, you know you have no premium. It'll eliminate the deductible. So if your coverage has a $100 deductible, a $300 deductible, or $405 deductible, the extra help will pay that deductible for you. It'll reduce copays. So every drug, remember I was talking about the tiers? When you have extra help or Medicaid, those tiers go away basically. You have two categories now, generic, name brand. It's generic and it's covered by your plan on the formulary or list of drugs they cover, you pay $3.35. That's the most. Some drugs are cheaper than that, you'll pay lower than that. Name brand, the most you'll pay is $8.35. That's this year's numbers. Those numbers adjust a little bit each year. And it gets rid of the coverage gap. Why? Because it gets rid of the deductible and all the other ways. It's really impossible, unless you're taking 1,000 medications a day, to hit $3,000 out of pocket to even get to the coverage gap. So it gets rid of the coverage gap for you. You don't have to worry about, what if I get out of the first bucket? You don't have to worry about that. And then it weighs, like I said, the late enrollment penalty. So if you would have had a penalty, it'll get rid of that for you as well. Any questions about drug coverage before I transition into Part C?
I have a question about A and B.
Okay.
You were talking about if you don't sign up in time for the drugs. Is there also a penalty if you don't sign up for Medicare itself within that 7-month period?
Okay, so the question is there a penalty if you don't sign up on time for Part A or Part B? And it's, yes, there is. Part A, most people just sign up for it because if you work at least 40 quarters or 10 years and pay taxes, or if your spouse did and you were married for at least 10 years, then you're eligible for Part A at 0 premium. If you don't, then you could have to pay a premium. Part B, everyone has a standard premium for, but there is a late enrollment penalty for B, which is 10% for every 12 months that you went without coverage when you should have had it. So, long story short, don't miss your windows. Contact me or someone else that can help you not miss those windows. So again, prescriptions, drugs, A, B benefits, and then extras are what are included. So Part C is also known as Medicare Advantage plans. Most of you have probably heard this terminology, Medicare Advantage plan. It's really an internal industry acronym for Part C. But that's the difference. Part C is Medicare Advantage. So you have to have Part A and Part B because it's combining and taking over covering the benefits for Part A and Part B. So you have to have Part A and Part B to get a Part C plan. What happens is they're all done by private insurance companies. So this is the Anthem, the Aetna, the Bright Health, the Humana, the United Healthcare, the Kaiser. That's what's available here in Boulder County. They're the only ones. So there is no government option for Medicare Advantage. What's happening is the government switches the risk for you financially over to the insurance company, and they start sending them a subsidy for your premium. So they basically pawn you off on an insurance company because they think, here, you take the money, you pay the bills. So the insurance company takes the money, pays the bills, makes a profit, adds some extra benefits in. That's kind of where the situation. So Part C plans, in my opinion, for most people, they offer you a lot of extras that you wouldn't normally get if you just have Part A and Part B. And that's whether you have Medicaid filling in or you have a Med Sup. If you just have Part A and Part B, all you have is medical coverage. You have Plain Jane medical. There is no vision, there is no hearing, there is no dental, there is no extras, no nothing. So it's not a Medicare supplement. So a lot of people get those two confused. Medicare Advantage is that I have a Medicare supplement, and then in fact they have a Medicare Advantage plan. So big difference. Usually you're paying a premium above $100 a month if you have a Medicare supplement. Medicare Advantage plans are a lot closer to zero. Hold on one second. The question is Advantage better than United Healthcare? Yeah, United Healthcare does have Advantage plans, and they do have Medicare supplement plans too. Which one's better? It would depend on, you're going to be different than you. What your prescriptions, your doctors, all that stuff would tell me the answer to that question for you. Yes, ma'am.
Aren't they the supplement plans that you can use in any state?
MedSups, well, there's a misconception with that. Okay, so portability. That is one of the strengths of a MedSup, because you can go to, in essence, any hospital in the country, because the government has a behind-the-scenes gun to the head of the hospital, you have to take Medicare. So they're forced into it. Hospital-wise, I would say yes. Nationally, you have a much better, broader choice with MedSup. Medicare Advantage can be more local network, usually be restricted to the state that you're in. But the other positive of that, doctor side. That's where the coin flips. No gun held to the doctor head, so a lot of doctors, if you were to call around today right now, spend the next 3 hours calling, out of 100 doctors, you might find 10 that are accepting new patients for Medicare A and B. And the reason is the reimbursement rates are so different. So these Part C plans, let's say they say, okay, Dr. Jones, we'll pay you $100 if Susie comes in to see you. Medicare says we'll give you 55 or 60. And so there's a 30 to 50% gap between the reimbursement rates. And so I would agree, nationally, hospital-wise, MedSup. But again, most people in this room, unless you're different than what I've experienced so far, are in a low-income situation. And so the MedSup goes out of the equation anyway, especially if you have Medicaid, because Medicaid stops at the border of Colorado no matter what. And so national portability for that kind of stuff typically isn't going to come on in the equation. But yes, that's a good question. Must have Part A and Part B, so you have to stay on those. You have to continue. If you're supposed to pay for Part B, you have to continue to pay that premium. You must live in the area this plan is available. So these plans are county specific. What's available in Boulder County is different than what's available in Larimer County. What's different than what's available in El Paso County. And so county-specific plans, so you got to live in the county, and then you must not have end-stage renal disease. If you have end-stage renal disease, there is a special needs plan designed for that, or you go with a Medicare supplement. Most folks, my recommendation would be going with a Medicare supplement if you have ESRD. Let's see, you have that. Costs, so low to no premiums is one of the advantages of Medicare Advantage. Most HMO products have that low to zero premium. Every carrier, Anthem, Aetna, United Healthcare, Kaiser, you name it, everybody has a zero premium product. You might even be on one right now. Must continue to pay Part B. Again, this adds A, B, and D benefits into one. The rule is they have to be as good as or better than the government model. Then you might see some extra benefits. And that's really where the extras, for someone in a low-income situation, that's really where the extras come into play, because you can really get some good benefits that save you money. Costs, we already did that one. Coverage, oh, I used to get it next. Oh, that's what I did. Special needs plans. So it's basically the same thing. They're Medicare Advantage plans, but they're designed for a special needs specific population. In Colorado, the only ones we have are what are called dual special needs plans, or DSNPs, and those are designed for people with Medicare and Medicaid. If you have that situation, if you have Medicare and Medicaid, you would then qualify for one of these special needs plans. The special needs plans are just extra loaded up with some extras that kind of help people in that situation. So I would cross over into selling if I go over any of the specifics of any of those benefits, but I can tell you there are things like dental and vision and hearing and other things like that on those kind of plans. Oop, what did I miss? Every one of these special needs plans has to have a drug card built into it. So on some Advantage plans, for veterans, they have some Advantage plans that are designed with no drug card in them. All special needs plans will always have a drug card. This is a chart for the eligibility levels. And I know that Miss Andrea does have a copy of it, because she gave me one, not this exact version, but one that she had gotten from, I think it was SHIP, right? But again, income is the first variable, and so that's why I said on, where's partial LIS?